Good morning, everyone, and welcome to The Balancing Act. We are so glad you joined us this morning. I'm Julie Moran.
And I'm Olga Villaverde.
Today in our Behind the Mysteries series, we'll be looking at liver cancer, and it affects 1 in every 35,000 people each year. But the good news is there are new treatment options available.
And keeping it positive, it's time to think about our summer vacation plan.
Love that.
So, how does an island adventure sound?
Oh, incredible. I mean, I love the idea of a tropical paradise, and we've got just the destination in mind, the British Virgin Islands.
Ooh, so grab your sunscreen, ladies, and your itsy bitsy bikini.
I'm ready.
The Balancing Act starts right now.
Let's go.
Okay.
Let's go now. Every year, 1 out of every 35,000 Americans are diagnosed with liver cancer. And while it affects slightly more men than women, caseloads are rising. Fortunately, certain novel treatments offer hope and extended quality of life. Joining us today to talk about liver-directed therapy and interventional oncology is Dr. Maureen Cohey, an interventional radiologist at the University of California, San Francisco. Welcome, doctor.
Thank you.
So great to have you here. Doctor, liver cancer is slowly rising. Do we know why?
I think one of the main reasons is because we're getting better at detecting it. So early screening results in early detection and a rise. Another reason is because we're seeing an increase in the risk factors. For example, more people are being diagnosed with viral hepatitis. We have a rise in obesity, in type 2 diabetes. So all of those can account for an increase in hepatocellular carcinoma or liver cancer.
Well, talk about the risk factors for a moment. What are they, and will reducing those factors help reduce the chance of coming down with the disease?
The most common cause can be viral hepatitis. So hepatitis B and C can cause liver cancer down the road after a couple of decades. Another cause is alcoholic liver disease. So binge drinking over a course of your lifetime can cause cirrhosis and then liver cancer. Also, fatty liver disease from obesity or from type 2 diabetes. So trying to avoid viral hepatitis, getting vaccination for hepatitis B, for example, leading a healthy lifestyle,
right.
Limiting alcohol, exercise can definitely reduce and prevent the risk factors and reduce the risks of developing liver cancer.
Okay, talk about some of the novel treatments. Those are good things, specifically liver-directed therapy. What exactly is that?
So liver-directed therapy is a procedure that we do where we inject small beads, such as LC beads, into the arteries that supply the liver cancer. And by doing that, we block off the artery from supplying the tumor oxygen and nutrient, and it results in the killing of the tumor. But the problem is that not everyone diagnosed with HCC qualifies for transplant or surgery. So one great novel technology is a liver-directed therapy with the death of the cancer cells, and so the tumor gets smaller, so the patients have more time to get a liver transplant, or the tumor gets so small that the surgeon can finally take the patient to the operating room and remove the tumor, and it will enhance their survival.
Are there any side effects?
Usually we do this procedure in the hospital, and an interventional radiologist performs it. It can be on an outpatient basis, and the patient goes home after a short recovery or potentially after an overnight stay. The symptoms aren't as bad. This isn't systemic chemotherapy. Usually patients just feel a little tired for about a week, or they can have some pain, very mild pain, that responds to medications that we give them. Their quality of life is not changed. They live in their house, they do their activities. You don't need to go to chemo, for example, every week or twice a week or things like that.
Well, that's great news. And is this liver-directed therapy for anyone suffering from primary liver cancer?
There are some specific criteria, so the best thing to do is to ask your doctor if you qualify for a local regional therapy for your liver cancer, if that were to be a concern.
Well, great news. Thank you for coming in, Doctor. Such
you.
great information. And there's always lots more important information to be found on our website, thebalancingact.com. And of course, we invite you to share by logging on to Facebook/The Balancing Act Fans.
Indications: LC-bead and LC-bead M1 are 510K cleared by the FDA for the embolization of hypervascularized tumors and arteriovenous malformations, AVMs, in the USA only. Cautions: embolization with LC-bead and LC-bead M1 microspheres should only be performed by physicians who have received appropriate interventional occlusion training in the region intended to be embolized. Potential complications: undesirable reflux or passage of LC-bead or LC-bead M1 into normal arteries adjacent to the targeted lesion, or through the lesion into other arteries or arterial beds, such as the internal carotid artery, pulmonary or coronary circulations, non-target embolization, pulmonary embolization, ischemia at an undesirable location, capillary bed saturation, and tissue damage, ischemic stroke or ischemic infarction, vessel or lesion rupture and hemorrhage, neurological deficits including cranial nerve palsies, vasospasm, death, recanalization, foreign body reactions necessitating medical intervention, infection necessitating medical intervention, clot formation at the tip of the catheter at subsequent dislodgement.
Palm trees, warm water, sandy beaches. Now that's my idea of tropical paradise with George Clooney. In fact, it sounds like the perfect summer getaway. Well, our next guest is here to take us away, literally away, as we discuss the pleasures of an affordable, world-class, multiple island retreat for this summer's vacation. You liking this? I am too. Time to head to the British Virgin Islands with their Director of Tourism, Sharon Flaxmars. Good morning.
Good morning. How are you?
Good. Did you like my George Clooney?
Yes, I did.
Can you bring him to me?
You never know. You never know. In the British Virgin Islands,
Anything goes.
Anything is possible.
I love her. All right, so let me ask you something. As a vacation destination, and I'm blushing a little bit now, the British, Virgin Islands, it sounds amazing. Is it good for everybody?
It's actually perfect for anyone. It's a wonderful destination, family-oriented. If you're going on a honeymoon, anniversary, wanted to bring the extended family,
Really?
there's something for everyone.
So let's do geography here. Where are the British Virgin Islands located?
Yes, we're located very close to St. Thomas, U.S. Virgin Islands, as well as Puerto Rico.
Puerto Rico.
Puerto Rico.
La isla del encanto, as we say.
And we're very close, only about 60 miles away from Puerto Rico and only about half an hour flying.
Okay. What's on the agenda when you get there?
You can be as busy as you'd like, or you can be as relaxed as you'd like. We have a collection of 60 islands, islets, rocks, and keys. So there's something for everyone. Some islands are populated, and some, there's nothing there but beautiful beaches.
So if you want to veg, you got it. And if you want to do things and be active with the kids, you also got it.
Yes, we have canopy tours, lots of sailing, there's parasailing, there's even kiteboarding for the ones who are a bit on the adventurous side.
So let's talk about the BVI resorts themselves. Walk me through there. I get there and what?
Well, a collection, as I said, we have lots of different islands, and our accommodations run the gamut. We have private island resorts, such as Peter Island. There's also Guana Island and Scrub Island. And again, we have the main islands of Virgin Gorda, Tortola, Jost Van Dyke, and Anegada. And those islands have accommodations ranging from resorts to island villas to little jewel properties that are nice for families.
Now, is it easy to get from one island to another?
Yes, island hopping is a breeze. In fact, we tend to think we have the best islands in the Caribbean for island hopping because they're very close to each other, and we have an extensive ferry system. Or you might not even want to do a ferry. You can take a private boat, or you can charter a yacht. In fact, I commute daily from one island to the next for work.
Now, let me ask you something in terms of, just pricing, because a lot of times when I think of going on a vacation with my family, times are tough, everybody's counting their nickels and dimes right now. So are there special offers, discounts?
Especially this summer.
Really?
In the British Virgin Islands, we have wonderful packages with our properties. In fact, we're calling it Summer Freedom. You think that summer is the time to relax and to be free. Well, we have lots of free inclusions. We have free nights, stay 7 nights, get 1 night free. We have free car rentals thrown in. In fact, one property is even offering a free excursion to a neighboring island. It's very affordable for a family of 4 or 6.
Okay, and something that is huge for me is food.
Lots of choices, lots of nice culinary delights, and we have lots of fresh seafood that abounds in the BVI. And you can always try your local dish, fish and fungi.
Fish and what?
Fungi.
What is that?
It's something. It's made out of cornmeal and okra, and with a nice Creole sauce. Oh. So you have to try
a
that.
little zing to that as well.
Yes.
And shopping, I'm assuming, for the ladies that want to go and shop, and for the daughters that love to shop with mommy.
In the boutique gift shops, you can pick up something really nice, and there's always something a little different to bring back home to say, guess what?
Guess where I was?
I was in the British Virgin Islands.
And it really is accessible to anybody, whether you're living in Seattle, I know we're in Miami, we're close, but there are connections no matter what.
Yes, the major carriers can get you into St. Thomas or San Juan, and then it's either a short ferry ride over from St. Thomas, or flying into San Juan. You can take what we call a puddle jumper, a smaller airplane, directly into Tortola.
I am going to take my girls and my husband, and I want some of that. What was that again?
Fish and fungi.
Fish and fungi. It sounds a little risque.
Yes, but that's what BVI is about.
I like
that you something with an edge, something that's different. We like to say, yes, we're different.
And I am a risky girl.
Yes.
Thank you so much.
You are most welcome.
Really appreciate it, and you've really got the best job of the century. I wish I had your job.
Thank
you. Of course, I'm ready with the bathing suit. I'm ready with the sunscreen. My girls are ready. Honey, I'm not sure if George Clooney's there. I might leave you at home. Just kidding. And if you'd like to know more about great summer getaways like the BVI, visit us at thebalancingact.com. Also share with us your summer social best by logging on to Facebook.com/The Balancing Act Fans.
This morning, we welcome back Juliet Diorio Garcia from Acceptance Insurance for the fourth and final part of our conversation on you and your car insurance. So do you really understand your policy? Exactly what are you covered for? And are there any limits? Well, Juliet is here to demystify it all. It's so nice to see you again.
Thanks, Julie. It's great to be back.
We all take our car insurance, I think, for granted, or even see it as this necessary evil. Unfortunately, when something happens, most of us really don't understand our coverage. Can you just kind of give us a breakdown of what typically is covered in a policy?
Sure. There are two basic types of coverage included in a policy. Liability. Think of liability as covering the other guy.
Okay.
And then comp and collision, and think of that as covering you.
Simple. I got that. Of course, we all know one of the main reasons for car insurance is liability coverage. Could you just break down liability and how that affects our premium?
Absolutely. So liability is comprised of two elements: bodily injury, causing injury to somebody else, and property damage, damaging someone else's property. Think about this in terms of the other guy. So if you cause an accident and you cause bodily injury, those numbers that you see in your policy that are, maybe 30, 60, 30, and you've seen the slashes, the first two numbers are the bodily injury numbers, and the third number is property damage. And those are the amounts that your insurer will cover. But then you can elect to increase those limits if you so choose. There's just a cost consideration.
So essentially, minimum limits is just the baseline, and then you can add on to that?
Yes.
And they are required state to state everywhere, right?
Everywhere by law.
Okay. How about comp and collision? What should we understand about them?
Sure. So comp is short for comprehensive, and that covers things that are, think of them as an act of God. A hailstorm damages your car. Collision is exactly what it sounds like. Covers your car from collisions, accidents.
You know, understanding is great, but many of us have like teenagers in our household. We have seniors that may not totally understand their policy. How can we help them, and what should we know about keeping those type of costs down?
You kind of hit on it already. Teens and seniors can create a rate increase and can experience higher rates on their own because they simply are a higher risk profile in some cases. So what I recommend is it's always good to talk to an advisor, an insurance agent, or go online and get yourself some information about having those people in your household and how that could affect your own rate and whether or not you should exclude them from your policy.
Good to know. Sometimes people have periods where they're financially strapped. What happens if you don't pay your bill on time?
You know, it's such a great question, and I'm glad you asked it. Think of insurance as a pay-as-you-go type of service. So while we never want to see people go without insurance, if you don't pay your bill, you have no coverage. That's how it works.
Simple as that. Oh, well, that's really good to know. And as we discussed before, people are sometimes embarrassed about how much they don't know. And if viewers and our viewers are shopping for insurance, how can they find you at Acceptance?
The best way to reach us is our website, which is acceptanceinsurance.com, and there you will find phone numbers to reach a live person, as well as a wealth of information on the site itself.
Good point, because some people really want to talk. They want to talk. They want to talk to a live person, so you offer that as well.
We do.
Oh, that's so good to know. I mean, this is your last visit. I just want to thank everybody from Acceptance for really educating us on this process. It was so great to have you back in the studio.
Julie, thank you. We really appreciated the opportunity to be here.
Oh, great. All right, and if you'd like to know more about non-standard car insurance, go to thebalancingact.com and follow the links. We're also on Facebook and Twitter as well.
Thanks so much for joining us today. We really hope you enjoyed the show. And if you want to learn more, just go to our website, thebalancingact.com. Great information there for you.
We are also on Facebook and Twitter. We want you to look us up. And until next time, remember, find your balance. So long, everybody.